Only 8 months ago, there was just a handful of people infected with what we now know as the COVID-19 virus. Now, it's nearly 12 million. Without physical distancing or mask use, each person can potentially infect 2 or 3 others. In densely populated environments, such as tower blocks, it can be as high as 5. And let's be clear, this virus is the same the world over, with the same potential to kill. A recent review has found that the COVID-19 death rate is somewhere between 0.5% and 1%, 5 to 10 times as deadly as seasonal flu. Given the virus doesn't change its behaviour, the best advice says we have to change ours. And the communication task to achieve that is enormous.
We were seeing governments making decisions that could be better informed by at least having some understanding of what people were doing and the reasons why they were doing them.
Professor Liam Smith's team at Monash University has been providing advice to the Victorian government. And they found that a key factor is who people trust to control the pandemic.
So the clear winner here is our national health authorities. They are easily the most trusted source. And the World Health Organization, indeed, was also a very trusted source. They've dropped to least trusted. There's a long body of literature that reinforces the fact that if we trust an information source, then we're much more likely to listen and adhere to its requests.
At the moment, what's needed is physical distancing and compliance with lockdown. What's been used to persuade people has been coercion and an appeal to public goodwill.
When you see some people that aren't doing the right thing, then you have to call that out. We need to be clear and direct and frank. They are rules that are there for everyone.
Most recent data shows 78% of people are indeed keeping physical distance. But we do need to think about the remaining percentage of people. Early indications are that if we tell people that keeping physical distance will keep their community safe, it's more effective than saying it will keep you safe or it will keep your family or loved ones safe.
There are also risks in communication by potentially focusing on people behaving badly.
We see communication about, oh, look at this huge group of people that are doing the wrong things, and that makes the problem worse. A particular example of that is toilet paper, of course. It was a sort of a self-fulfilling prophecy.
It's likely that many Melburnians have been psychologically flattened by this second lockdown, and that can affect how the brain hears the messages.
It will certainly make them less likely and to want to process information. They'll process it slower. And what that's likely to lead to is probably a lower level of compliance. We don't have the evidence to support that yet, but I think it is likely that we'll see lower levels of compliance in the future.
We all feel that this pandemic's been going on forever, but without a vaccine, we're going to have to live with this for a long time to come, which means leaders will need to continuously refine the way their messages reach us.
Hi, I'm Lee Sales. Thanks for watching this story. If you'd like to watch more of 7:30's stories, they are on the left of your screen. And tap on the button below to subscribe and get the latest from ABC News.